My name is Dr. Stephen Lupe. I'm from the Cleveland Clinic. I'm the head of behavioral health in the Department of Gastroenterology, Hepatology, and Nutrition. And the reason I'm here is I'm always looking for partners for us to build out innovative care models and to take care of patients in the best way we can. The thing that's so attractive about Market Connect is really that you get to meet with a bunch of companies and you can talk about what are things you can be doing with each other in fairly condensed little meetings. So you can meet with 15 companies as opposed to doing half-hour meetings and stuff. You can bounce very, very quickly. It's all right here. There's a matchmaking process that happens to make sure that you and the company are matched and you know something about them. Even at Vive, I've met Cook Unity, and now we've started building a program with them to do prescription meal delivery services for our patients. I've met other companies that we're still in the process of talking. How do we integrate you into this care model to make it so patients do have some care coordination? We are implementing some very, very innovative products to make sure we're taking care of whole human beings and providing the best care possible with minimum demand to the provider. What I would say to someone joining for the first time is go for it. If you have a good idea and you're a provider in the space, you're a clinician, come out here and talk to some of these companies. They can help you build out your ideas. You can even get advisory positions with some of these companies where they need you there and they need your clinical expertise to build their product. And there's all kinds of connections that can happen like that through a program like Market Connect, where you can meet a bunch of these companies, figure out what is out there, and be doing the best work possible. Next year, I look forward to doing more of this. Maybe I'll slow down a little bit and not take 25 meetings in a day. Every year that I come out to Health and Vive, the conversation changes a little bit, it evolves, right? So last year, it was very much based around what AI can do. This year, it's much more dialed back to let's be realistic about what some of these AI programs, and it's always so cool to hear the evolution of the space and what all of these great companies are doing within that space and what is realistic for what we can build. Something that would be added to the program in the next couple of years, I want to see more providers getting into the space and maybe making a space for healthcare clinicians to really come in and flesh out some of their ideas. Maybe we even do a meeting space like one of those spaces like the AI area or something for clinicians specifically, physician innovators, people like that, psychology innovators, so that they can all be in the same space and meet with some of those companies in a more informal way and really create that space for those people so they feel included into this environment. It's been amazing with introducing us to all of these companies and making some of these connections. So I know what everybody's doing out there and I can reach out to these connections as we try to build these innovative care models. Right? So like I said, with even food delivery, I knew Cook Unity from Vive, and it was oh, let me reach out to them and see what they're doing and if there's a way we can even be integrating into here. I met several companies even today that were how can we build a care model where you're backup so we can be referring the right patients to you and reducing access demands on the healthcare system. And so that's always the biggest thing for me is really getting to talk to our industry colleagues to figure out how do we build these models and how can we best optimize healthcare.